We are joined now by Derek Lesnow, CEO, and Brandy Smith, Director of Clinical Services from the Sims Foundation. Thank you both for being with us today.
Thanks for having us.
It's a pleasure.
Absolutely. So first, let's talk about why. Is there something unique about the pressures of being in the music profession that causes mental health problems?
So there was a study that was put out recently by an organization that focuses on mental health, and it basically stated that 1 in 5 Americans is going to experience a mental health challenge throughout the course of a year. And there was a study also done a few years back that recognized that 3 out of 4 musicians are going to experience a mental health challenge. And so it's exponentially more present in the music industry. And I think that has there's a lot of reasons that go into that, but you think about the innate aspects of working in that industry where you're touring long nights, you're playing late night gigs, you're traveling, you're away from your family and friends for a long period of time. And so I think there's a lot of aspects that music industry professionals deal with that lead to the result of them experiencing mental health challenges on a higher incidence than regular people.
And there's definitely, from what you're saying, like there's a lack of stability, which always can exacerbate mental health challenges. But, many people do face job stress, financial problems, a lack of stability, substance abuse, and relationship issues in their life. But that being said, why is that kind of doubly worse for musicians?
Well, I would love to just sort of jump in there and say that I think those pressures are highlighted. I think a lot of folks, in media, the media pressure today, social media, all of those challenges really experience imposter syndrome, this worry about perception, all those things. That is extraordinarily exacerbated in the music industry. And so folks are trying to keep up with AI. They're trying to keep up with their multiple jobs. Being a working musician is a challenge because the financial instability, the time away from home, as we discussed, all of those things, work is high pressure. The environment our industry professionals and our musicians work in is in a lot of ways even higher incidence of course, substance prevalence, pressure late nights, inability to keep up with healthy habits like good sleep, good diet, exercise. All of those things really add to what our clients experience on a regular basis.
It is undoubtedly hard to be a working musician these days. What should musicians and the people closest to them, their loved ones, be alert to when it comes to identifying that need for help?
I think the biggest indicator is probably a change, right? A significant change from previous behavior. That is, less able to handle coping, things that might not ordinarily have been so extreme or catastrophic to a person. Noticing those changes in their inability or less ability to handle those things. I think unhealthy coping, withdrawal, isolation, sort of pulling back from the things that are important to them, the ones they love, enjoying the things that used to bring them pleasure. It's a good thing to look out for those around, anybody, a loved one who's changing in that way.
And that being said, for people that may be unfamiliar with these challenges, this Mental Health Awareness Month, what do you really want to make clear and have people take away from this work that you do? It
is vital that we talk about it, that we normalize, not only just in the music industry and in those spaces, the venues, with the labels, record labels. It's really important that folks understand now's the time to talk about it. And there's no better time than right now to talk about how you're feeling. The more we normalize mental health as a part of our, overall wellness, I think the better off we're going to be. And so I think, talking, we need to educate folks. We need to be, we try to advocate for mental health in general, but specifically for our population, the unique challenges that they face. But I think there's so many barriers, including cost, which is what we're trying to help with our group. That's a whole nother discussion about the cost of healthcare. But absolutely just not being afraid to say, I'm not feeling okay today, and I need to stop, and I need to take care of myself. That's going to help any person be better for the folks around them and for their own long-term outcome and wellness, mental health and otherwise.
You said it great. It's removing that stigma, and that's the second half of our mission. It's not only connecting clients to the care that they need, but it's making sure that the community understands that it's okay to not be okay. And when that happens, reach out, ask for help. There are resources out there, and we just want to make sure that people don't feel that isolation that can lead them to taking measures into their own hands or not recognizing how much they're loved. Just recognizing that it's okay to not be okay. It's not a sign of weakness to ask for help. It's actually a sign of strength.
That's well said, too. Checking in with your loved ones and also checking in with yourself. That is such an important lesson for all of us to really learn this Mental Health Awareness Month. Well, thank you both for coming on and sharing your thoughts with us and for the important work that you and the Sims Foundation are doing in the music community.
Thank
you so much. Really appreciate it.
Thank you.
Thanks so much for watching. Be sure to like and subscribe and leave us a comment below to let us know your thoughts on this video. And don't forget, you can watch full episodes of Austin Insight for free in the PBS app.